My name is Alejandra Cerda, and this is Bella Jimenez. I am recording this video as part of the neurovascular assessment video for a nursing skills course at Nightingale College. Bella Jimenez, do you understand and consent to participating in the skills demonstration and being recorded for internal educational purposes, including grading and program review by faculty and institutional accreditors?
Yes, I consent.
Alrighty, perfect. So first I will go ahead and knock on the door, ask for permission to come in. Once permission is given, I will perform hand hygiene, introduce myself to my patient. I will go ahead and ask for 2 patient identifiers and match them with the patient's wristband. What is your name and date of birth?
Bella Jimenez, January 13th, 1992.
Alrighty, perfect. Next, I will go ahead and explain the procedure to my patient. Today I'm going to be doing a neurovascular assessment. Is that okay with you?
Yes.
Alrighty. So first, I'm going to go ahead and start with the primary sensory responses to superficial touch and pain. I'm going to go ahead and use this pen. I'm going to go ahead and tap with either the sharp end or the dull end, and I want you to tell me which one I'm tapping on you, okay? So with your eyes closed, perfect. I'm going to go ahead and start.
Sure. Dull. Sure.
Alrighty, perfect. Next, I'm going to go ahead and do the perception of position sense. So go ahead and put your hands on your knees and fan out. You can do this with either the, if you're doing it with the feet, you would do it with the great toes, but we're going to do it with the hands. So we're going to go ahead and start. I'm going to have you tell me whether it's up or down, okay?
Okay. Down. Up. Up. Down.
Alrighty, perfect. Next, I'm going to go ahead and do the ability to identify an object by touch and manipulation. I'm going to have you close your eyes once again and then put your hand out for me. Okay, go ahead and tell me what that object is.
Key.
Perfect. Next, I'm going to do the 2-point discrimination. I'm going to use 2 pens for this. I'm going to go ahead and tap on your arm. And I'm going to get closer, and I want you to tell me when it's 2 points and then when you feel 1, okay?
2. 1.
Okay, so I'm going to go ahead and document that distance between the 2 points, the last 2 points that the patient felt. And I'm going to go ahead and chart that measurement. Next, I'm going to go ahead and have my patient put their hand outward with their eyes closed. Perfect. I'm going to write a number, and I want you to tell me what the number is, okay?
3.
All right. Perfect. Next, I'm going to go ahead and do the identify a body area that is touched. So I'm going to have you close your eyes. I'm going to go ahead and touch different parts of your body. I want you to tell me which part I just touched, okay?
Okay. Shoulder. Elbow. Hand. Knee.
Perfect. Okay, next I'm going to go ahead and do the superficial and deep tendon reflexes of the bicep and patellar tendon. I'm going to go ahead and support my patient's arm. I'm going to go ahead and make sure, let's see, perfect. Okay, so I'm going to go ahead and tap on the patient's antecubital space where my finger is right over, so I'm going to tap on my finger but not the patient herself. And then I'm going to elicit a response. Okay. Perfect. Next, I'm going to go ahead and test the patellar reflex. I'm going to go right below the kneecap to the side, and then go ahead and tap there to elicit the reflex. Okay. Perfect. Okay, next I'm going to go ahead and do the plantar reflex. So I'm going to have you remove one shoe. Okay, so I'm going to go ahead and, perfect. I would go from the heel of the foot, lateral, inward. No reflex is also normal. And then another normal reflex is if the toes would fan forward. If they would fan outward, then that is a negative reflex. Go ahead, that's for that. Next, I'm going to check the ankle clonus. For these tests, you do them on both sides, but for the sake of the timing of the video, I'm going to go ahead and just do it on one. So for this one, go ahead and push the patient's foot upward, downward, up, and then when it went, perfect. So when it went down, it went straight down. So that is negative clonus, which is a good response. A negative response would be positive clonus, which would mean the foot would go upward and then it would shake when it comes back down. Next, I'm going to go ahead and do a cerebellar function and proprioception test. So for this, I'm going to have you with the heel of your foot go towards the shin of your left foot. Perfect. Now we're going to go ahead and do that with the other side. Perfect. Next, I'm going to go ahead and test the coordination and fine motor skills. So I'm going to have you go ahead and go like this with your eyes closed and then go as fast as you can. Alrighty, perfect. Next, I'm going to go ahead and have my patient stand up. We're going to do the Romberg test. Okay, so I'm going to have you stand up. I'm going to stand on the side of the patient for patient safety. For this one, we do it for 60 seconds. So let's say that we're doing this for 60 seconds with the patient's eyes closed. I'm going to be checking for any swaying or any movements. Alrighty, let's say that was 60 seconds. Next, I'm going to go ahead and test my patient's gait and posture. So first, I'm going to have you run in place. Alright, perfect. Next, I'm going to go ahead and have you walk back and forth. Perfect. So for this, I'm checking the gait, the posture, her position, and any swaying, and then her sequence of her steps and her stride, as well as if there's any arm movements. Alright, go ahead and sit back down. And that concludes our neurovascular assessment. I will go ahead and make sure my patient is comfortable. She has everything she needs. Before I go ahead and exit the room, before exiting the room, I will perform hand hygiene one more time, and then I will go ahead and chart the outcome of the assessment. Thank you.